Hi, my name is Jon Clay. I am the Manager of Talent Acquisition here at Children's Hospital Medical Center. Part of what I do is I oversee all of the recruitment for Children's Hospital with the exception of physicians. So we work with all of our advanced practice providers all the way down to our entry-level roles and food services and environmental services and things like that. Some of the challenges I think we currently face right now is the shortage of healthcare providers, whether that be your nursing staff or OR techs, and I think just having the ability for additional candidates, I think, to come out each year. So we struggle, I think, finding enough people to fill our open vacancies. It was kind of a roundabout way for me to even get here, actually. I had a completely different mindset. I actually grew up and wanted to be a police officer, so I ended up joining the Marine Corps. I actually ended up recruiting then for the Marine Corps, and that kind of changed my passion for what I wanted to do. And so when I decided to discharge from the Marines, I came back to Omaha and was introduced to a healthcare staffing firm here in town, and then started my healthcare recruiting career, I guess, in physician recruitment, which led me kind of to always wanting to do an in-house physician recruitment. So when Children's brought me over here, this was kind of a dream job for me to come on and do in-house physician recruitment. Especially working at Children's Hospital and being in the world of pediatrics is having my own kids and understanding like everything that I am currently doing will have a, could greatly impact their lives at some point. And so I think that's also part of why I enjoy what I do, knowing that I'm not a clinical person, I'm not on the bedside or anything like that, but all my work and efforts go towards the overall mission of Children's Hospital and Medical Center, and our day-to-day continues to impact our patients' and families' lives. If you're not connected with Avenue Scholars, it's definitely something that I would recommend and suggest looking into. As I kind of took over this role last fall and been introduced and working with Avenue Scholars up until this point, it's been kind of rewarding to kind of see the opportunities that they provide to the students here in the community, understanding how they can connect and continue to maybe start networking with the different organizations and setting them up for future success. Because healthcare is consistently changing, I think everyone is out there to kind of create or find or do the next best thing, and so it was neat to kind of see some of the futuristic goals and a lot of the research that a lot of our current providers do, and showcasing of what could be changed and what could we change in healthcare and what could we do to continuously improve and make things either more efficient or more effective. Growing up, I'm originally from a small town, and when I ever thought of a hospital or a physician's office, I only just thought doctors and nurses worked there. And I think the one thing that I would suggest to especially students that might have an interest in healthcare, but more specifically maybe not something that is clinical or bedside, just understanding that you can do pretty much anything within a hospital organization. So if you're obviously looking to be a nurse or CNA or something in the clinical field, we have multiple openings for that to consider and kind of showcase of how you can get to that point. But I also like to make it aware of if you have an interest in IT, if you have an interest in marketing or accounting or anything like that, you can always come back and look at Children's because we have all those different types of opportunities. And so I think that's also another part that's fascinating in terms of healthcare because of how many different areas it also continues to include and touch along the way.